You are listening to Why I Vaccinate. I'm Ann Thomas, and I'm here with my co host, Veronica McNally. And we now welcome Dr. Nicole Linder. She is with St. Francis Hospital in the Upper Peninsula, and she specializes in hospitalized patient care for COVID in a rural setting. Dr. Linder, thank you for joining us today.
Thanks for having me.
And Veronica, I'm going to turn this over to you to kick this segment off.
Dr. Linder, thank you so much for being with us. I wanted to just start by kind of having you walk us through what you do on a daily basis in the hospital.
Well, we take care of all general medical care of patients in the hospital, not just COVID, obviously. So we take care of all the patients that come into the hospital through the ER that are sick enough to be in the hospital. We take care of them through their entire hospital stay, hopefully, unless they need to be transferred to a higher level of care. We are a small, usually 25-bed critical access hospital. We do not have a full ICU, and we don't have any other medical specialties available. And so that's kind of the gist of what we do. During COVID, we were able to expand our bed capacity by 5 additional beds, and we have that in place again right now because of our case volumes increasing again. And so we have become quite adept at taking care of COVID. We've taken care of a lot of COVID. Our county has some of the highest numbers in the Upper Peninsula and has through most of the pandemic.
How is your staff doing? What are you seeing in terms of their morale?
Well, it's been challenging. We did lose quite a few of our more seasoned veteran nurses during the pandemic after the first big waves that we had. And our staffing is, lower. We struggle at times to staff appropriately. And a lot of our staff is new grad nurses now. So that also can be a challenge in a time like this where it's harder to do a lot of teaching because you're just trying to get through the day. So that's been an issue. And I think that this time is harder for the staff. During the first go round, it felt, it was scary and, it was still very ill patients, but there was nothing that we could have done to prevent these things from happening. We just had to do our best to help them get better. And this go round, it does feel harder because you're taking care of these very ill patients and you feel that this didn't need to happen to them. You feel like everything that you're doing is kind of unnecessary in a way. And I think that is harder for our nurses, especially the nurses that have been there through the whole pandemic. It's almost a little bit like Groundhog Day. You think we all thought, when the vaccine came out that would really kind of get us out of this, and that hasn't come to fruition. So that has been stressful.
And are you hearing remorse from the patients as well? Obviously, I know it's very challenging for the nurses to be experiencing that, but what are the patients saying?
Most of them pretty quickly do, make statements that they wish they had been vaccinated. Some really never do. That's another thing that's different than the first go round. This go round, the patients that we're seeing haven't been vaccinated by choice. And some of them have very deep-seated beliefs that COVID is not real. And we have sometimes there's a lot of denial that they don't even believe that that's what's wrong with them. And their family doesn't believe that that's what's wrong with them. So that's a very unusual challenge in medicine, to have to be met with that much disbelief and kind of an alternate reality. So that's been challenging for all the staff as well.
And what are your statistics in terms of those who are admitted who are vaccinated versus unvaccinated?
Oh, I believe we've only had, I can't say for sure, but I only recall 3 patients admitted that were vaccinated. And actually 4, because one was partially vaccinated, had one dose of the Moderna vaccine, and then was ill at the time of their second scheduled dose. And so it just kind of, didn't get rescheduled. But none of our vaccinated patients have been, really critically ill and, needed to be transferred to a higher level of care. I tend to you see a different pattern in just the recovery, and even in the laboratory changes. You see that if they've been vaccinated, their immune system is able to, at a certain point, just kind of turn the corner, and everything just gets better really quickly in comparison to the natural history of COVID, where things either take a turn for the worse at some point and never recover, or you see a very gradual improvement after a certain point. So I would say it's very different.
I know, Anne, you have some questions for Dr. Linder.
So, with regard to these adults that are coming in and talking to you about, I guess, their disbelief in COVID, are they explaining why they aren't trusting you and the medical science? Like, who are they, or where are they getting their information, if not from medical science?
Yeah. I have had patients say that they watched too much of certain TV channels. I have had patients say that they, believe too many things they read on Facebook or online. I have had a patient and their family who their reason for not believing in COVID was that they said that COVID was against their religion, that the religion told them that COVID wasn't real. I don't know what religion they were speaking of. I'm not aware of any organized, recognized religions having an anti-COVID or anti-COVID vaccine stance. So I can't comment more specifically about that.
And what are some of the reasons for not getting the vaccine? What are they saying with regard to why they just will not go there?
Most of what I hear is that it's, a foreign substance that they're injecting in their body that they don't feel has been fully tested enough, or fully proven to be safe enough, or even fully proven to be effective. I think a lot of the patients that are still unvaccinated, you start with a belief that COVID isn't real, or definitely isn't as bad as, we in the medical community know it to be. There's a kind of a belief that it's really just like the flu. We hear that a lot still too. I thought this was supposed to be just like the flu. And so when you start with that kind of belief, then taking a vaccine that they feel to be risky or unproven for something that isn't even real is an easier choice to make. So I think there's just many layers of misinformation and incorrect assumptions and beliefs.
Dr. Linder, how does the medical community feel about how we get out of the pandemic? We keep telling people they need to be vaccinated, but as you're explaining to us in this interview today, it doesn't look like a lot of people are going to do that. So how do we get out of this? What's your thinking on this?
Unfortunately, I don't see us truly getting out of it unless we are able to reach a point of kind of what we call herd immunity through vaccination and driving down the levels of circulating virus. I hate to sound like a pessimist or a doomsdayer, but I feel at this point, and this is my personal opinion, I am not an epidemiologist, that I almost feel like we're in a race between vaccines and variants. And at some point, with all this COVID circulating and infecting more and more people, every time it infects someone, that's another chance for it to mutate into something that the vaccine is not going to work against.
Do you tell the vaccinated patients, or I should say, do you tell the patients who have had COVID already but are not vaccinated to get vaccinated?
Definitely. Always.
And why do you say that? What do you say to them?
I explained to them that having a natural case of COVID or an actual case of COVID protects them for several months from reinfection, definitely from the same variant. But if they are challenged with a different variant, we don't know if they're protected. And we do know that their natural immunity wanes over time. And so I always tell them, you do not want to roll the dice twice. You were sick enough this time to be in the hospital. We don't know if you get a second infection with a different variant, what that's going to mean. And please get vaccinated. You'll have much broader and more long-lasting protection.
Dr. Linder, I just wanted to ask you about availability of vaccine in the Upper Peninsula. Where are patients able to go to get vaccinated? How plentiful is your supply?
Very plentiful. They can get it at all of the physician offices. They can get it at all the local pharmacies on a walk-in basis. They can get it at through the health department. There is no shortage of vaccine. It's very widely available. It is free, no matter what. I've heard people saying that financial concerns. There is no financial concern. It is free. I've heard reports from some of the clinic doctors that I know that they've been having to destroy lots of vaccine that goes unused, and that's just heartbreaking to me. You know, those vaccines need to be in the arms of people here and around the world if we are going to recover from this.
Dr. Nicole Linder, a doctor who deals with hospitalized patient care for COVID in the Upper Peninsula, St. Francis Hospital. We really appreciate your time today. Thank you for spending time with us, and thanks for the expertise.
Oh, thank you for letting me speak. It feels good to actually get what is in the minds of a lot of us healthcare providers out there.
You are listening to Why I Vaccinate. We'll be back right after these messages.